You're watching the Fox 5 Morning News at 7.
The FDA warns consumers to avoid more than 100 different hand sanitizers. Dr. Richard Chaffoo joining us now to explain the dangers. Dr. Chaffoo, good morning. Good to see you.
Good morning. Good to see you, Shally.
I pump a lot of hand sanitizers every business, everywhere I go, right? And some of them have this smell that I often stop and wonder, ooh, I wonder what's in this.
Exactly. And that's a good point, like you mentioned in the lead-in. I mean, most of the sanitizers, Shally, that we get in the United States that are regulated by the FDA are fine to utilize. However, there are some that come in, south of the border and other areas. And there are a couple of chemicals that I think it's important for the public to be aware of in hand sanitizers that are potentially dangerous and not safe. One is called 1-propanol. It's not isopropyl alcohol. People might be confused with that. Unfortunately, this can be very toxic and life-threatening. You can see central nervous system depression, and there are reported cases of death. So that's one to really look out for. Another is methanol. Methanol is better known as wood alcohol. And the problem, Shally, is it can get absorbed through the skin. It can be, of course, ingested. And there are cases of hospitalizations. Unfortunately, there are cases of blindness and death. And so those are two chemicals to take away from this to look out for with sanitizers.
There are many, many different brands that have hit the market over the past few months. And I'm looking at this list. I'm trying to see, have I run into any of these brands? If people have some at home right now and they want to take a look.
They want to look. These are all really ones on the FDA's, no-fly list. So these are not good to utilize, and many of these are made south of the border and elsewhere. So you want to look for these and see whether you have any of those. They're not sold, typically in the United States at grocery stores and drugstores, but you always just want to be careful because the toxicity with those can be significant.
When you talk about, I just saw the Hello Kitty, by the way.
Me too.
Right, the one with because they market that, and you see that with the kids.
Yes, exactly. They're marketing to kids, and as we said, toxicity. There's a much smaller margin of safety, unfortunately, with kids, and it's easy for kids to get a hold of these and get them in their eye, of course, on their skin, ingest them, and they can have catastrophic outcomes. And
what happens if you do use these sanitizers that are not safe?
Well, the problem is with these is, the first one, the 1-propanol, you can actually have central nervous system depression. So early symptoms of ingestion may be getting confused, a decreased level of consciousness, and then, slowing of the pulse or the heart rate and slowing of breathing. If it gets on the skin for a prolonged period of time or on the eyes, you can get irritation to the eyes, you can get rashes, and there are some cases of allergic reactions to that.
When you go, let me see if I can find one. Hold on, wait a second. Let's do this together because I want to be able to, I think I have one right here. So when we pull up a bottle of our hand sanitizer, they have the spray one, they have the cream one. What are we looking for on the back that we know that these are safe?
Right.
Give us the big words.
Right, so made in USA, probably number one.
Okay.
Number two would be that you want to look for a sanitizer that has what's called 60% ethanol or ethyl alcohol.
60%.
60%. Not what we said earlier on methanol. Methanol is the wood alcohol. You don't want to see that.
Not methanol.
And death with that agent. So you want to look for those two. And then I think it's really important, Shally, to let people know that, like we have talked about so many times before on the show, that you don't need a hand sanitizer if you've got warm water and you've got soap. 20 seconds of washing with that, you're going to get rid of the COVID-19 virus vast majority of times. But certainly if you're going to use a sanitizer, use the one that we just mentioned where it's got the 60% ethanol. And you want to make sure that even with these sanitizers, although they're safe, Shally, we want to keep these out of the reach of children because children tend to experiment with them. They might put them in their mouth or in their eye, get an irritation. And so really you want to supervise your kids very carefully, not just give them the sanitizer to use as they like to. And there's also really for the public, the FDA has put together a nice link. If you go to fda.gov/drugs and just type in the search bar on the top, hand sanitizers, you'll find all this information with what are approved hand sanitizers, what are the chemicals to look out for.
I think I've bought more hand sanitizer in the past few months than I have in my whole entire life, Dr. Chaffoo.
I hear you, right?
Right? Well, thank you. And I have a feeling they're going to be around for a really, really long time. For a full list. Time. Yeah.
Not going anywhere.
They sure are not. For a full list of the toxic hand sanitizers, head to fox5sandiego.com. Click the See On tab. Mine has grapefruit in it.
Time now for your morning.